Hello and good day. This is Dr. Raju Khubchandani, Sectional Head, Paediatric Rheumatology at SRCC Children's Hospital, managed by Narayana Health, speaking to you from Mumbai. Today's topic is a very topical one in that as we approach World Rare Diseases Day on the 28th of February later this year. This tradition began in France on the 29th of February 2008, but subsequent years, the last day of February is observed as World Rare Diseases Day. So what constitutes a rare disease? It's very geography and country dependent. And in India, we look at a disease which affects 1 in 5,000 people as a rare disease, while there is another category called ultra-rare diseases, which affects 1 in 50,000 or so. Now, when we look at the total number of diseases known to mankind, there are about 30,000 such diseases. Of these, a staggering 1/3 or about 10,000 are deemed rare diseases, with about 200 to 250 being added every year. And about 70 to 80% of rare diseases are genetic in origin. Rheumatologic diseases occupy second place in the rare disease category, and then there are multiple miscellaneous small entities which complete the list. The impact of rare diseases in children is indeed startling, as some of the statistics will show you in the visual alongside. When it comes to genetic disorders, a very interesting article in the New York Times called Southeast Asia, a living lab for genetic disorders. This happens because of the frequency of consanguinity. What this means is inbreeding or family marriages. And this visual of the map of India shows the areas where consanguinity is highly prevalent. Moving to rheumatologic disorders, the approximation is that about 7 million children get affected with rheumatologic disorders. But the merit or satisfaction that we get from treating these patients is that their mortality is low and the outcome of treatment is very, very rewarding and satisfying. Children with rheumatologic disease face several problems. First is the diagnostic journey, and by the time they reach a pediatric rheumatologist, they have gone through a maze of referrals. And then subsequently comes the issue of access, since they often reach our center after multiple transport issues, etc., and therefore follow-up becomes a challenge. Cost of care. cost of diagnostics, cost of medications also weigh heavily on the family, besides misinformation and parallel systems of medicine. And last but not the least, not to criticize anybody, but adult medical experts are often not aware of the pediatric range of diseases, and therefore transitioning care is also a challenge. We at the Department of Pediatric Rheumatology at SRCC Children's Hospital, managed by Narayana Health, are fortunate that we are able to provide multi-team or multidisciplinary care to such children, and are privileged that over 4,500 children have placed their health and their well-being in our hands, and we have been able to serve these families with the best that we can